When Sharon lost the mayorship, I was not likely to stay a second term. What I didn't say was 8 months as principal deputy corporation counsel, I got a promotion to city administrator because the city administrator moved, left the administration, and Sharon went searching for a new one and selected me. I, to this day, have no idea how or why she made that decision. Maybe I know what she said, but it was the one job I can say that I've had that was hard. It was hard not because it required more smarts, though it did require smarts. It was hard because you were always working. There was never a point at which, as the city administrator or as the mayor, where you weren't on, where people can call you in the middle of the night and you've got to move, you've got to do something. And then everybody knew you. So everywhere you went, you go to a party, they had a problem that, I took to taking a little notepad to come back on Monday to try to respond to some of the people that I met. It was also a job I had to stretch. I had to learn and stretch in doing it. It was the hardest job I've ever had, but the best job that I ever had, in the sense that I learned a lot. I learned how to help people. I learned things that didn't work and how you had to change to make some things work. And I just got exposed to so many things.
Any one person or memory stick out in your mind from that time? Something that you were able to affect?
I have several memories of that time. People don't talk about failures very much, but this is something I talk about from that era. We did a lot of good, important things and made a lot of positive changes in the city. And we have a record to prove it. They don't talk about it as much, but it's there. But I remember one of our failures and something that I really learned from it. At the time, we were alarmed at the number of low birth weight babies that were being born in the District of Columbia, and that was the time of the crack epidemic as well. Vincent Gray, who later became mayor, was head of the Department of Human Services, very committed to children, as was the mayor. And we really wanted to do something about low birth weight babies. One, we wanted to get as many of the residents who qualified for Medicaid signed up for Medicaid so they could get better health care. And we wanted some of the younger girls who were becoming pregnant to get prenatal care. Before, we wanted them to see a doctor at least 4 times before they gave birth. That was the standard. And we had a partnership with Georgetown, and we had Georgetown had a bus that we were going to go around and make certain that we signed up all of these people for Medicaid, and we got these young women who were expecting to see a physician or a nurse aide. And we went all around to some of the poorest sections of the city with that bus and knocking on doors, trying to get people to sign up. And not that many did.
Why?
And, well, because they didn't really know who we were. And they didn't trust us.
So lesson learned. It
was a lesson learned that if you're going to try to get people to do real behavioral change, which is what that required, you really needed to get them to tell you how that should be done. We should have been doing some conversations with people in the beauty shop and in the clubs and talking about the problem and what would make people, what would it take to make you want to go get some prenatal care. It was a real learning experience for all of us. I think we called it a failure because our goals for that particular activity had not been met. But we were successful later in learning how to do that. And it was one of I've carried that story with me a long time, and I've told it many times over, because people who think they know something about communities really don't know what they think they know. And people in communities know far more about what moves communities than what the experts know.